So relations is usually the difficult part of the anatomy. So let's begin with the relations of thyroid gland. So as you can see that each lobe of the thyroid gland is roughly pyramidal in shape. So it has a base, as you can see here. It has three surfaces. One is medial, one is lateral, and the other one is posterolateral. It has two borders. One is anterior border here and one is posterior border, and then all of these join and then they form an apex. Extends up to this oblique line of the thyroid cartilage, and it is sandwiched between two muscles here. Outer one is the sternothyroid. Just outside thyroid gland there is a muscle called the sternothyroid, and inner one called the inferior constrictor muscle. The relations of the base of the thyroid gland are two. One is inferior thyroid artery and the second one is the recurrent laryngeal nerve. The lateral surface has three strap muscles. One is the sternothyroid, then second is the sternohyoid and the omohyoid, that is superior belly, and just a part of the sternocleidomastoid, which is nothing but an anterior part of the sternocleidomastoid. In order to remember this from outside to inside, there is a mnemonic SHOT. The outer one is sternocleidomastoid, which stands for S. The H is for hyoid, so sternohyoid. The O is for omohyoid, superior belly of omohyoid, and the T is for thyroid, sternothyroid. See the medial relations of thyroid gland. So here you can find two tubes, one is trachea and the second one is esophagus. You will find two cartilages, that is thyroid and cricoid, and you will find two muscles, the cricothyroid and the inferior constrictor. Here you can clearly see that there is a carotid sheath, and this consists of internal jugular vein, common carotid artery and vagus nerve, and behind this carotid sheath there is also a sympathetic chain. Now there is something called ansa cervicalis which is present in the anterior wall of the sheath, and this ansa cervicalis will be dealt later in the deep cervical fascia chapter. Anterior border is comparatively thin and separates the medial and the lateral surface, and it is related to this anterior branch of the superior thyroid artery. The posterior border is usually thick and round, and it separates this medial surface from the posterolateral surface. There are two relations. One is the anastomosis of the superior thyroid and the inferior thyroid artery, and the second one is the parathyroid glands, as you can see in this. Now we'll see the relations of the isthmus of the thyroid gland. So here there are two surfaces, anterior and the posterior, and there are two borders, that is superior and the inferior border. So the relations of the anterior surface are two strap muscles. One is sternohyoid and the other one is sternothyroid. So it's these two muscles. When we come to the posterior surface, we already know that it's the second, third and the fourth tracheal rings. Let's move on to the borders. So the superior border is related to the anastomosis of the anterior branch of the superior thyroid artery, and the inferior border is related to the thyroidea ema artery if present, and also the inferior thyroid vein.